I know many of you have experienced some record low temperatures, freezing rain and snow, power outages in some places, and a slew of other not so fun situations. So thank you all for being here again. Hope you're all safe and warm. You know, unfortunately, these winter events and I think the season itself are things that can contribute to loneliness and isolation, which happen to be the topic of today's webinar. We greatly appreciate Karra Harrington joining us today and sharing her experience and expertise with you. Before we introduce her, I just want to give you a few updates on what's happening at Arden Courts, or has been over the past 30 days. First and foremost, I am thrilled to share that all of our communities have had their first vaccine clinic, and some have already had their second. So very thankful for that from a residents' perspective and our employees. If you are interested in your loved one becoming a resident and receiving the vaccine, I encourage you to reach out to your nearest Arden Courts. As you probably have heard, each state, each locality is doing the vaccine distribution a little differently, but reach out to get a little more information. I think the vaccines are really important, not only just to protect our residents and employees from the virus, but as more people get the vaccine, we move closer to reopening our doors and returning to pre-pandemic life, which is something I think we can all agree would be great to return to. We've been very fortunate over the past 11 months, relying on our over 25 years of dementia caregiving experience, as well as the clinical expertise of our parent company, ProMedica. I think the two paired together, we've done our absolute best to minimize the risks related to the virus, and I think respond more quickly and confidently to help meet the needs of our residents and employees. So very appreciative of that. On that note, we are working diligently with our clinical support team to identify the what, the how, the when that we can welcome families and friends back into our communities with as little restrictions as possible. Many of the Arden Courts communities are already beginning to offer scheduled indoor visits with some limitations. So again, encourage you to reach out to your nearest one to learn more about that. And lastly, I just want to share that pretty much all of our communities are offering a variety of ways for you to experience each of the communities. Some are offering in-person tours of non-resident areas, including our wonderful courtyards when not covered with snow. So for those of you in Florida, come enjoy the courtyards. I think we can all agree, though, that spring can't come soon enough. We are all anxious to get back out and thoroughly enjoy the courtyards more and get you all to kind of experience our communities a little bit more so you can get to see how they might help your loved one. But until then and throughout the rest of the year, we are going to continue to bring these virtual webinars to you wherever you may be. During today's webinar, if you have any questions about the information covered in the presentation or about Arden Courts, please type them in the chat box and we will do our best to answer them at the end of the webinar. Or you can reach out to your nearest Arden Courts. You can find the one closest to you by visiting arden-courts.com. And again, thank you for being here on today's webinar. I'll turn things back over to Kelly.
Thank you. I did type in the website in the chat room too, and it's the location page. So all you have to do is type in your city and it should take you to the nearest Arden Courts location where you live. So let me go over a couple of housekeeping items before we get started today. This webinar is going to be recorded. You will be able to view the webinar a few days after the event. It will be uploaded to our library of virtual webinars, which is on our virtual events page, which I will type in the chat room after I stop talking. You can view those at any time. You can review, rewind if there's something that you want to concentrate on. If you want to share it with a friend who you think might benefit from the information, you can send them the page and they'll be able to view it just like you. Also, a few days after the event, we're going to be sending out an email with a link for the recording too, so you could get it one of two ways. So today's webinar, oh, and then like Brandon said, we are going to be utilizing the chat function today because we have so many people joining us. The chat function can be utilized if you take your cursor and go towards the bottom of the page, hit the thought bubble that says chat, and then make sure that you are saying to all panelists and attendees. So we'll be doing that after the event. So let me introduce our speaker today. Without further ado, our speaker is Dr. Karra Harrington, who is a postdoctoral scholar for the Center for Healthy Aging at the Pennsylvania State University. She's also a clinical psychologist whose research interests include reducing loneliness in vulnerable populations, prevention of age-related cognitive decline and dementia, and the development of digital tools to enhance psychological assessment and intervention methods. So today, Dr. Harrington is going to be speaking about loneliness and social isolation's impact on aging, which I couldn't think of a more appropriate topic, especially with what's going on in the world today, and especially in our populations who are living with dementia. So without further ado, let me introduce our speaker, Dr. Harrington. Nice to meet you.
Thanks so much, Kelly, and thank you to you and Brandon for the opportunity to present today. I'm really excited to speak to everyone. Bear with me for just a moment and I will get my screen shared so you all can see my slides, and then I will start sharing some information. Okay, so hopefully you can all see my slides now. So I'm very happy to have the opportunity to speak to you today about loneliness and social isolation and their impact on aging. Okay, so today I'm going to start out by giving an overview of the definitions of loneliness and social isolation. These terms are sometimes used interchangeably, but they do really refer to different but related concepts. So it's important that we know what the difference is between them and also maybe how they're similar so that we can just be aware of what we're talking about when we're using these different terms. Then I'm going to talk about what the impact of loneliness and social isolation have on physical, mental, and brain health, and really think about why it's so important that we consider these factors, especially for older adults. Next, I'll review who is likely to be affected by loneliness and social isolation, including how prevalent they are among older adults, and also what factors might make someone more vulnerable to experience loneliness or social isolation. And then finally, I'll talk about some strategies to help recognize and also overcome loneliness and social isolation. So is this man lonely or socially isolated? Well, we can't tell just based off of the fact that he is alone. So loneliness refers to subjective feelings of dissatisfaction with social relationships, whereas social isolation is about a lack of social connections or social relationships. So isolation is really more to do with the size and the composition of someone's social network, rather than their feelings or their perceptions of their relationships, which would be more related to their loneliness. So for example, someone might live alone, but not feel lonely despite having few social connections or spending a lot of time by themselves. And the opposite is also true. It's possible to spend a great deal of time around others and maybe have many friends or family connections, but to still experience loneliness. So in the case of our gentleman here, he may be feeling lonely, or he may be enjoying some time out by himself. While we can see objectively that he is alone, we don't know how he feels about that experience. And we also don't know if he's on his own by choice or if he didn't have anyone else to come out for a walk with him today. And so this is really a key point that I want to make about loneliness, is that from the outside looking in, it can be very hard to tell if someone is lonely or not. And we really need to consider their own perspective and preferences to understand what their experience is. To give you a bit more of a formal definition of loneliness, the definition shown on the screen here is the scientific definition that is most widely accepted. And so you'll see this reported in a lot of different places. And really what this definition has is two components. So the first part is about a perceived discrepancy between an individual's desired and their actual social relations. So this can either be about the quality or the quantity of their relationships. So it may be that someone feels that they would like to be closer to someone in their life, maybe to their partner or maybe to their children, maybe to a friend. Or it may be that they feel that they don't have as many friends or as many family connections as what they would like to have ideally. So an important note is that it is about their perception of that. So we might be on the outside looking in thinking, wow, they have a great relationship with their children. But for their own experience, they might feel like, actually, I wish I could spend more time with them, or I could even be closer to them. So really, we can't tell from the outside. The other component of this is that it involves a negative internal experience. So this is your feelings of being alone, possibly feelings of distress, but at least some discomfort that comes from this perceived discrepancy that the person is noticing. And so it's these two pieces together. It's feeling that I want more, either in quality or quantity, and feeling this discomfort about that feeling of wanting more. A couple of other things I want to note here is that loneliness can be chronic or it can be transient. So that means some people will feel lonely consistently over time. So whenever you ask them, they're always going to say, yes, I feel very lonely. While other people might only feel lonely for a short period or for at certain times. So it comes and goes. The other thing that I want to note is there is a stigma about feeling lonely, but it's a normal human experience. We all feel it from time to time. And in fact, it serves an important purpose because it signals to us that we need to connect with others. And so we can think about this as being similar to the way that the discomfort of hunger signals to us that we need to eat. And that discomfort motivates us to get up and go get a snack or cook a meal. The discomfort of loneliness is designed by our body to motivate us to go and seek out support from someone or go and seek out having that social connection. So it really does serve an important purpose. Social isolation is somewhat different. So the definition of social isolation is really about a lack of social ties in an individual's social network. And this can include minimal social contact with others, low levels of social participation, or few social connections. So note that this is different from loneliness in that it's not about how the person feels about their relationships. It is about objectively what relationships they have. And so a person can be socially isolated but not feel lonely. And the converse is true, that a person could have many social connections and frequent interactions but still feel lonely. So often social isolation is assessed by looking at the number or the frequency of social contacts. How many friends and family does this person have? How often do they interact with them? What their living arrangements are. Do they live with other people or by themselves? And how involved they are in their community. Are they a part of a community group? Do they go to religious services? Do they do volunteer work? So how engaged they are with their community. Okay, so we talked about what the difference between loneliness and isolation is. And next, we're going to talk about how does social isolation and loneliness impact on physical and mental health. So in terms of the impact on physical health, the consequences of both social isolation and loneliness can be quite substantial for older adults. So after we take into account how old somebody is, their gender, their socioeconomic status, their health status, their physical activity, and whether they smoke or not, the increased likelihood of premature mortality or death is estimated to be about 26% for people who feel lonely and about 29% for people who feel socially isolated. So to put that into context for you, there have been some studies that suggest that the increased risk of early mortality due to social isolation and loneliness is similar to that of smoking about 15 cigarettes per day. So if there's such a substantial influence on premature mortality, then what about other health conditions? So the research in this area is growing quite quickly. And what we see is that people who are lonely or socially isolated are more likely to have multiple chronic illnesses or physical health conditions, and also to have a greater number of medical visits and hospitalizations. So they're really needing to seek out more medical care. and that they're less likely to engage in health behaviors like physical activity than their non-lonely or isolated peers. We also see that they are more likely to have poorer cardiovascular health and hypertension, heart disease and stroke, reduced immunity responses and increased inflammation, poorer sleep quality, impairment in terms of cognitive function, so things like memory, and also functional impairment, so having greater difficulty with doing their day-to-day activities. All of these are often reported to be associated with loneliness. So while being lonely doesn't necessarily mean that you'll experience all of these, the risk of having poorer physical health is greater for someone who is lonely than someone who is not. In terms of mental health, I want to first note that loneliness is not a mental health condition in and of itself, but it is often related to other mental health conditions. So loneliness has what is referred to as a bidirectional relationship with both depression and anxiety. And in terms of anxiety, particularly with social anxiety, which is about our worry about how other people might perceive or judge us. And so what this bidirectional relationship means is that people who experience loneliness are at a greater risk to experience either depression or anxiety, and that people who are experiencing depression or anxiety are at a greater risk of also experiencing loneliness. So you can see the two are going back and forth, influencing each other. What we also see for some people who experience loneliness is that it can trigger a downward spiral where the person increasingly experiences negative thoughts and feelings and withdraws socially. So where the person will have a personal, skipped ahead one, let's go back, where the person will have a circumstance or an event, or perhaps they will have a relocation, or they might experience a bereavement, and that triggers the loneliness. And then they experience these negative thoughts and feelings related to the loneliness, which influences their behavior and leads them to withdraw from contact further from others. So they may be thinking, that they're not getting what they need out of their interactions, or they're not enjoying their interactions, and so what's the point? And so they withdraw further and further. And this sets up this cycle that keeps the loneliness going and keeps the person stuck in the loneliness. Okay. Loneliness and social isolation have also been linked to brain health in several ways. And this is in particular for older adults, which is why I especially wanted to point this out for you all. So firstly, older individuals who are lonely are estimated to be at a 26% estimated increased risk for dementia over 5 or more years, and are also more likely to show signs of early stage Alzheimer's disease on brain scans, even if they don't show any signs or symptoms of dementia or Alzheimer's disease at the time when they're given the brain scan. And this is relative to people who are not lonely. Secondly, individuals who are lonely also show more rapid decline in cognitive ability than those who are not lonely, which is shown on the figure here. So on the side, we have a marker of cognitive ability. So you can think of it as like a memory score, and a higher score means that you're doing better. So as we see the lines going down, we're seeing that people are doing worse on this type of test. And so across the bottom, we have time in months. And so as we're going across, we're seeing both of these lines are going down. So both groups are getting slightly worse. But if you look at the light gray line, that is the group that isn't lonely. And then compared to the dark gray line or the black line, that's the group who are lonely. And so you can see that the group who are lonely are getting much worse at this test over time compared to the group who are not lonely. And then finally, neuroimaging or brain scan studies with older adults show that loneliness and social isolation are associated with smaller volumes or some shrinkage of brain areas that are central to the cognitive processing, so our memory or our thinking skills, and our emotion regulation skills. So you can see the brain scans on the screen here, and on each scan, there's a little section that's colored in that shows the part of the brain that we're talking about. But what I want to point out is as you look down, you can see that there's quite a number of different regions of the brain that are impacted, and that these are involved in things that are really important for our attention, for our memory and learning, but also for our social interactions. So it's affecting our empathy, our inhibition, and our impulse control. So that's being able to stop ourselves from maybe saying something that's not appropriate or doing something that we don't really mean to do, but impulsively we feel like we want to. And also affecting our emotion-guided social interactions. So the way that we interact with someone when we see that maybe they're sad versus when they're happy. Those are all areas of the brain that are affected by someone feeling lonely. And so what we usually kind of, I guess, conclude from seeing something like this is that maybe the fact that these parts of the brain appear to be a little bit smaller in people who are lonely might suggest that they are also having more difficulty with these skills or these abilities that we know are controlled by those parts of the brain. And so we think that maybe this could contribute to some of why we see people having an increased risk of dementia or having a faster rate of decline in cognition. This is still a very new area of research, though, that I want to point out and mention. And so it's not necessarily a cause for alarm, but it is something that is developing and we're learning more about all of the time. It's still not very well understood. It is thought that negative consequences of loneliness, like stress and reduced social interaction, likely contribute to some of what we're seeing here, but really we do need to do further study in this area. Okay, so we talked about what the difference is between loneliness and isolation. We talked about how they impact on physical, mental, and brain health. So next, let's talk about who is lonely and socially isolated. So in terms of prevalence, the estimates of prevalence, or the proportion of people who are socially isolated or lonely in the population, vary a lot between different studies because of differences in the way that social isolation and loneliness might be measured or asked about, and also because of differences in the way different studies include people in or out of the study. So depending who you ask might depend on whether they say they're lonely or not, and depending on how you ask if they're lonely or they're isolated might depend on the answer you get as well. So there is a little bit of murkiness here, but I'm going to present to you what seems like the best evidence at the moment. So recent studies in the US among community dwelling adults aged over 65 years. So these are people who are still living in their own homes or living in the homes of friends or family. These studies estimate that almost a quarter, so about 24% of these individuals are socially isolated, and about 4% are severely socially isolated. So in these studies, social isolation was defined according to 4 domains. So they were looking at whether people were living alone or living with others, how many people they had in their discussion network, so whether they had at least 2 people that they have regular conversations with, whether they attend religious services regularly, and whether they participate in social activities. So how involved are they in their local community? Do they do volunteer work? Are they part of any clubs or organizations, things like that? And so people who didn't have any of those things, they're living alone, they don't have 2 people to talk to, they don't go to religious services, they're not involved in any clubs or other organizations. That's that 4% that are severely socially isolated. The 24% were individuals who had one or two of those things, but they didn't have all four. So they're people who really have a limited network or are living alone and aren't very involved in the community. In terms of loneliness, estimates are about 43% for adults aged over 60 years or older, and that these are people who are lonely at least some of the time. So this is what we consider to be more of like a moderate loneliness, while 13% report feeling lonely often. And this is really more of what we would consider to be more of a severe loneliness, because they're reporting that they feel lonely quite often. So it seems to be impacting on them more. Now, in terms of estimates in residential care settings, these are thought to be higher, but there are some important notes about this, because often studies don't look at what the type of care setting is or what the nature of the setting is and the programs that are involved. So really it is a little bit more nuanced, but the estimate is that about 61% of adults aged over 55 years living in residential care report moderate loneliness, so feeling lonely at least some of the time. Now, in addition to the note about not taking into account the different types of care facilities, I also want to note that there are many factors that may contribute to these higher rates of loneliness in these settings. So, for example, those individuals who are entering care may already be more lonely or socially isolated than those who are remaining in the community. So, for example, they may have recently lost a partner or be experiencing increasing frailty or mobility issues that contributes to the transition into care, but also is likely to contribute to an increase in loneliness. The other note here is these studies don't necessarily take into account how long the person has been in the care setting. And so someone who is just newly moved into a care setting is still adjusting to a new social environment. They're still making new social connections. They're getting to know the staff. They're getting to know their new friends that they're living in the care setting with. And so they really need to make a new set of connections. And so once they've been there for longer, it gives them more time to be able to adjust to that, and also to adjust to the new routine in the setting as well. Another note is that because these are about publicly declared feelings and there is a stigma, some people may withhold their true feelings of loneliness when asked. So these rates may actually be higher in some cases because some people may not have disclosed how they actually feel. And this is especially true for older men who are likely to not disclose that they feel lonely when they're asked directly. I want to touch briefly also on loneliness during the COVID-19 pandemic. And of course, there has been a lot of concern about the potential for increased loneliness during this time. And certainly it's something that we have all likely had some experience with over the past year or so in terms of not being able to go out and interact in the ways that we normally would. So I want to present a little bit of data from a study that I'm currently working on and hoping to publish soon. So for this study, we interviewed 228 older adults who were living in the community in New York in March, April, and May last year. So these were all people who were participating in one of our existing studies. So we knew about their loneliness from before the COVID-19 outbreak, and then we were able to call them up during that really initial stage of the outbreak, when certainly New York was a key hotspot in the US, and find out about what their loneliness was like during the lockdown and the stay-at-home orders in New York. And so this is what we saw in terms of comparing their loneliness from before to after the outbreak. So on the side of the graph, you have the percentage shown, and then across the bottom, you have the lonely and the not lonely group. the dark blue bars are representing the percent of people that we spoke to that were lonely before the pandemic or were not lonely before the pandemic. And then the light blue bars are representing after the outbreak. And so if we look at the lonely group, we can see that the percentage went from about 20% of our sample in the study, or our participants in the study, being lonely before the outbreak, and it dropped down to almost 15% after the outbreak. And then you can see the opposite happening in the not lonely group. So actually before the outbreak was about 80%, and then it's jumped up to not quite 85% afterwards. And so this is, I guess, a little bit different than what we thought, because we thought that actually we'd see more people reporting loneliness after the outbreak than before. So I do want to say that this doesn't mean that nobody's experiencing loneliness during the pandemic, but just rather to point out that there hasn't been as much of a large scale shift as what we might have expected. So we were certainly expecting that we were going to see a big increase, which is not what we saw. Actually, we saw there was not much change, if anything, a very slight decrease. But certainly there will be some people who will be more vulnerable. So for example, those people who live alone or who were already very isolated and maybe didn't have many social connections are likely to be vulnerable to be experiencing loneliness during this time. There are some things that seem to help in terms of trying to prevent or alleviate some loneliness. So taking an active approach to coping with the pandemic seems to be really helpful for people. So we saw that those who are engaging in more what we would call health behaviors to protect themselves from contracting COVID. So people who were saying, I do my hand washing regularly, I'm social distancing, those kinds of things had lower levels of loneliness. And other studies have also seen that people who were reporting engaging in more new activities at home during lockdown, so maybe trying out some new recipes or playing some board games with their family that they don't normally have time to, whatever it might be. Or also people who were keeping in more frequent contact with their friends and family were also less lonely during this time. So while the estimates that I showed you before about the number of people who feel lonely among older adults are certainly quite high and concerning, I want to also acknowledge that loneliness can affect individuals at any age. In terms of what age group is most at risk for loneliness, actually the evidence is somewhat mixed. So some studies show that with older age, people actually report lower levels of loneliness. And that's what you can see represented on the figure here. So on the side of the graph is the level of loneliness. And so a higher number here is indicating that you're more lonely. And across the bottom is age. So going from age 10 through to age 100. So as we look across, we see a peak in loneliness at around age 20. And then a decline from that point as age increases. So actually our oldest individuals in this study are the least lonely of anyone in this study. However, other studies find that there are different critical points across the lifespan where individuals may tend to report higher levels of loneliness. So on this second graph, we again have loneliness on the side with higher numbers indicating more loneliness. And again, we have age across the bottom. So what you can see here is there's sort of three humps as we look across the age span. So at around age 30, around age 50, and then again, an increase at about age 80. There seems to be more loneliness happening at these points across the lifespan, and then these decreases in between. So I do want to mention that further study is really needed to understand these patterns, and especially this pattern in people who are aged over 75, because many studies include relatively fewer adults aged over 75 compared to other age groups. So this means we don't have as much information or as good a quality information about individuals who are in this stage of life. And so you can see we're getting two different stories from these two studies. One is saying less loneliness in older age, and the other one is saying more loneliness. What is clear, though, is that individuals at all ages can be impacted by loneliness. And so we wouldn't necessarily consider older age as a specific risk factor for loneliness. So if older age may not be a risk factor for loneliness, then what factors could contribute to being more likely to experience either loneliness or social isolation? Well, there are some factors that can contribute to these experiences at any age. So how engaged we are socially, the number of friends we have, and how frequently we're in contact with our friends and family. Those seem to be important no matter our age. But then there are other things that are important for certain age groups. For older adults, we can break these down into social, health, and psychological factors. So in terms of social factors, being unmarried, either due to widowhood, never having married, or being divorced, having no surviving children, being a member of a marginalized group, such as being LGBTQI+ identifying, or having low frequency or poor quality of social contact, all factors that can increase our vulnerability to experience loneliness. So they're not going to guarantee that we're going to be lonely or socially isolated, but they increase our vulnerability to experience that. In terms of health, having poor self-assessed health, so feeling that your health isn't as good as you would like it to be, or isn't as good as it should be, having more chronic illnesses, having disability or sensory impairment. So if you can't hear well or you can't see well, it might be very hard to have as good a quality social interactions as you would like. Or if you're not able to go out, your mobility might be impacted. It could be difficult to see friends and family because you might not be able to get out and do as many things as you would like. And certainly cognitive impairment as well. So if you have a memory difficulty, it could be quite hard to have a conversation with someone and to remember what you've talked about or keep track of the conversation. Or you might forget that you've seen friends or family as well. And then in terms of psychological factors, certainly loss and bereavement can become increasingly frequent experiences in older age. And then also sometimes when people are experiencing loneliness, they can also develop this sense of low self-efficacy and low self-esteem. So particularly feeling that they're less confident in their ability to form quality social connections or to have quality social interactions, which can then contribute to them withdrawing more and being more stuck into that loneliness. And also, as I mentioned before, about mental health conditions, and personality can also play a role. And I also want to mention, though, that there are factors that can be helpful. So it's not all doom and gloom with these things. And so even having one quality relationship, whether it's one trusted friend, a trusted partner, a close relationship, or even having a pet to interact with, can help reduce the risk of experiencing loneliness or of being isolated. And so noting that none of these is a guarantee for loneliness or social isolation, or any combination of these doesn't mean that you're definitely going to be lonely or socially isolated. But as people are collecting more of these risk factors, it means that they certainly are becoming more vulnerable. So if we recognize these things in ourselves or in someone that we know, it might mean that we want to try and keep a closer eye on how they're doing socially and trying to offer some support. But seeing this in and of itself doesn't necessarily mean that someone is lonely or isolated. Okay, so we've covered our first 3 points. And so now next I want to move on to talk about strategies to recognize, and then also to help overcome loneliness and social isolation. So how do we know if someone is lonely or not? So, I've said a few times today already, we can't see from the outside. It's really about the person's experience and how they feel about their relationships. And so there are many number of tools or questionnaires that have been developed to try and assess loneliness. And so here I'm just showing two of the most commonly used measures that we see very frequently used in the research, but could also be used in care settings and things like that as well. So what I want to point out about these two different questionnaires is you can see that they're both relatively brief, first of all, so 3 or 6 items. And also they give people some option about how to respond. So it's not just a yes or a no, but the options are still relatively simple too. So it's also not too complicated to figure out how you want to answer, but at least you have a little bit more choice than just yes or no. So this type of format is generally preferred for older adults since the number of questions is not overwhelming, and the simple response format can be used even for people who may have cognitive difficulties. And then looking at the items, you can see that these questions, they focus on how people feel about their relationships or their social interactions, but they don't directly ask about loneliness. So these are what we call indirect measures of loneliness, because you don't see the word lonely in any of them. And this is really done to try and get around that stigma that I mentioned, where people don't want to say that they feel lonely. And so by asking things about how often do you feel that you lack companionship, do you feel left out, do you miss having people around you, do you feel like you have people you can rely on, these kinds of questions are trying to get at how do people feel about their relationships without directly saying, do you feel lonely? But what else can you ask? Because you might want to check in about loneliness, but you might not want to do it in such a formal way, especially if you're trying to check in with a loved one. And so there are questions that you can ask the person. So first of all, maybe the most obvious one, the most direct one for sure, is do you feel lonely? And as I mentioned with this question, if you do ask it, and certainly there's nothing wrong with asking in this way, but just keeping in mind that some people will say no to this question, even though they do still feel lonely because of that stigma of loneliness. They feel embarrassed or they feel uncomfortable to share that that's how they actually feel. So sometimes also following up with some indirect questions might be helpful. So you could also think about asking something like, what time of day do you like to be with other people? Tell me about what you enjoy doing. Would you like some company? So you can see these are less direct, maybe a little bit less confronting, but help give you a way into having a conversation about how they're feeling about their relationships, or whether they're feeling like they want someone else to be with them at that time. Another approach that can be helpful is also observing the quality of their social relationships and how they're participating in activities. So this could give you some clues about whether the person is feeling lonely, and also might give you a point of knowing whether it's a good idea to ask some more questions to try and understand. So for example, you might notice that the person is starting to contribute less to conversations, or they're withdrawing from social activities that they usually participate in or they usually really enjoy. And so that could be a sign that they're feeling lonely. So as we've already talked about, it can be difficult to know that someone is feeling lonely from the outside because it isn't necessarily reflected by them being just on their own. And so we'd really be looking for whether there's been a change in how they're interacting or what they're participating in. The other tricky thing is that loneliness can be transient, meaning it comes and goes over time. So some people will feel more lonely at certain times of day or at certain times of year. For example, at night, around Christmas, on a death anniversary of a loved one. So this means that if you're trying to work out if someone is experiencing any loneliness, you may need to check in with them about it over time. So it may be when you ask the first time, no, they're not feeling lonely. They're interacting with you, or maybe they're feeling fine. But maybe when you ask them at another time of day or in several months, then they may be in a different situation and feeling a different way. So when should you offer support? Well, not one size is going to fit all. It's really going to depend on the individual. And so it's important to take into account that person when you're trying to address loneliness and social isolation, and think about what support is going to be meaningful for that person. So it means thinking about who this person is, what their preferences are, and in what ways are they able to engage. So thinking about if someone has difficulty with their hearing, what settings are they going to be able to best interact in? Maybe having them in a setting where there's lots of background noise is not going to be the most helpful because of their difficulty with their hearing. So really thinking about what meets their needs and where they're at. Another important thing to consider is their own choice. So does this person want an intervention? Do they want support, or do they want to be participating in activities? It's really important to respect their own autonomy and their ability to choose what they prefer. I'm going to talk about this a little bit more in a minute. We have a model to think about how we do that. So thinking about someone's choice as well, just because we think, oh, they're not getting out there as much anymore, maybe we need to help them find a new group or a new activity. Maybe that's not what the person is actually wanting or needing. So we need to think about that as well. So this model is really helpful for considering how someone is coping or managing their loneliness. And this was based on interviews with older adults about how they manage their relationships and their feelings of loneliness. And so what the research found was that older people have certain preferences on both whether they prefer to cope alone or cope with others, and also whether they want to prevent or take action to address loneliness, or whether they prefer to endure or accept their experience. And so for many people, loneliness is a private matter to be managed without external support. And so they prefer to cope alone and manage these thoughts and feelings privately in their inside world. But some people do want to actively engage with other people or places in an outside world. So we need to consider where someone falls on these different trajectories or these different scales, sorry. So to give you some examples, so someone who prefers to cope alone, but who does want to do some action or prevention, then staying active, focusing on good times, which may be things that they're doing now, or maybe also things that they did in the past, and also establishing regular routines that they find helpful related to that staying active point, are the types of things that would fit for someone who is in that coping alone and wanting to take action. For people who also prefer to cope alone but are more coming from an endurance or acceptance stance, for these people, it's more about focusing on having a positive attitude and finding inner strength, of recognizing that loneliness is an inevitable experience. It's part of being human. We all feel it from time to time, but it comes and goes. And also for reframing the being alone or the isolation to see the positives of being alone. And so it's finding that enjoyment of the solitude. The people who want to cope with others, when we look at those who want to take action or prevention, then what we're seeing is these are people who are maintaining their social connections, or they're establishing new social connections. So they're planning or they're initiating social interactions. Maybe they're planning a family dinner or a party with their friends, or they're going out volunteering or caring for others. Maybe they're getting involved in community groups. So they're really seeking out opportunities to interact with other people specifically. And for those who are interested in coping with others, but are more in that endurance or acceptance phase, then for these people, they're focusing more on comparing how they're doing to others and maybe recognizing that I'm not so bad off compared to how someone else might be. At least I have these friends, or at least I have these family members who I maybe don't get to talk to as much as I would like, but I still have those connections, and it would be much worse if I didn't. And also focusing on accommodating the needs of others in their family. So potentially choosing to live alone or live apart from their family members in order to not place a burden on them. And so focusing on accepting or enduring that choice of being apart as a way of supporting others, of supporting their family. Now, in terms of approaches to loneliness, currently psychological approaches, and especially what's called cognitive behavioral therapy, has the strongest research evidence as an intervention for loneliness. So cognitive behavioral therapy really looks at the way that we think and the things that we do, and tries to redevelop these into a way that can be more helpful. And so it might seem counterintuitive that therapy is the most helpful thing because it doesn't necessarily involve connecting the person with lots of groups or activities. But what is important about this approach is that it focuses on addressing unhelpful thinking patterns and behaviors that are keeping the person stuck in the loneliness. So we talked about the downward spiral into loneliness earlier. And here, using these therapy strategies, we can start to work to create an upward spiral out of loneliness. So we're sort of reversing that spiral. So by recognizing and challenging unhelpful negative thinking patterns that are developed around loneliness and using strategies to reframe them into more helpful thoughts, then we can start to shift these patterns and create an opportunity for more positive feelings and maybe even experimenting with different behaviors. So this is a chance for people to maybe try out some of the things that I was talking about before, of staying active or joining a group, or engaging in things that they like to do by themselves even. But it's a chance to experiment and try things out. And so then as we continue, we experience more positive thoughts and feelings, or we experience a shift in terms of having less negative thoughts and feelings. And we spiral upward, continuing to lead to more positive feelings and greater engagement with people or with place. And so this is an important point because it doesn't necessarily mean that we have to be connecting with people all the time. Sometimes finding meaning in place or activity is also a way out of loneliness, especially for those who prefer to cope on their own. Now, there are other approaches that I want to mention, though, in terms of addressing loneliness and social isolation. So there is less research evidence to support any one of these particular approaches, but there's also not necessarily any adverse events associated with these. They're not going to cause particular harm to somebody. So I don't feel too concerned about mentioning them, even though there's less research evidence to support them. What we do know is that it's important for older adults to have opportunities for personal growth and development, for self-identity, independence, and to have reciprocity in relationships. So some of the approaches that have been tried are supporting older adults to access an online social media and email, and helping them to maintain communication with family and friends, or even to make new connections online as well. We also see different leisure and volunteer activity programs can be helpful in particularly maintaining previous identity and meaningful activity, whether it's something that the person has done previously throughout their life that they enjoy, or it's a way of connecting with something that they've previously enjoyed, or even finding meaning in a new activity, that can all be very helpful. Reminiscence therapy helps to encourage recall and sharing of experiences. So it might be looking at photo albums together or sharing old stories. And sometimes, especially for someone who is experiencing memory difficulties, having something physical to look at together, like a photo album, may be helpful to give some prompts. But it may also mean that for you as the person, you may need to give some extra support, especially if someone's having some difficulty in those areas. We also see pet ownership can provide companionship, opportunities for socialization. If you take the dog out for a walk, you might have people coming up to you to pat your dog or say hello. You might meet other dog owners at the park, and it also can give a sense of purpose in caring for the pet. Gardening, similarly, can provide a sense of purpose and meaning, and also opportunities for social interactions, especially if you're in a community gardening or gardening with others. And then in the research literature, we've also seen a lot of intergenerational approaches be tried, where younger people are brought into contact with older adults and working together on certain activities or projects. And it's really an opportunity for those reciprocal relationships that are going two ways, where the young person is able to come and share an activity or do something with the older person, but the older person is also able to share their wisdom, their knowledge, their experience with the younger person. Okay, so we talked about what the difference is between loneliness and isolation, how they're similar, but also importantly different. Loneliness is more about how I feel about my relationships. Social isolation is more about what relationships do I have. We talked about the impact on physical and mental and brain health, and certainly that these can be quite significant, especially for older adults. We talked about the prevalence of loneliness and social isolation, that these are quite high. About a quarter of older adults are socially isolated, about 40% are lonely. And we talked about some of the risk factors that can contribute to being more vulnerable. And then finally, we've talked about some strategies to recognize, thinking about some of those questions you might want to ask, and then also some strategies to help overcome loneliness. Okay, so thank you very much for your attention. I appreciate the opportunity to speak to you all, and I'll be really happy to take any questions.
Yes, we did have a few questions that appeared in the chat room, so I'm not going to go in order. If you're in the chat room, I'm going to bounce around. There's one that came in that says, many elderly people have less ability to answer questions about their health and feelings as they age. Quite often, if you ask how they're feeling, they'll respond with, "I'm fine," especially when talking to a perceived healthcare worker. That may be because that they're scared of their declining health and abilities and want to feel less vulnerable. Yeah. And then we have another one that says, yeah, that's true, that her loved one flies to the doctor. Yeah.
Is there a question there, Kel? I mean, is it like how?
I think it's in relation to people with dementia. It was probably more of a comment to one of the things that came up.
The question is more, how do you determine if, so someone, an individual person with dementia that is not strong at communicating their emotions, their feelings, how are you able to determine if they're isolated or lonely? Maybe that's kind of the question for you.
Yeah, because that was the next question after that, is if they can't speak and it's hard to detect if they're lonely even.
Mm-hmm. Yeah, I mean, especially if someone isn't able to speak, I think that's an additional challenge. But certainly what we see is that people who are in more of that preferring to cope alone and seeing loneliness as more of a private experience, especially, those are the ones that are going to really struggle with being able to articulate that they feel lonely. And so I guess those are the people that you would be wanting to try and maybe ask some of those more indirect questions that are less confronting. So it could be really confronting if someone comes up to you and says, do you feel lonely? And even in the context of a more gentle conversation, that could be quite challenging thing to answer. So I would really recommend trying to ask something that's more like, would you like some company? Would you feel like you're having enough time with other people, as a way to try and kind of get around it? You've got to maybe be a little bit more sneaky with those people than being so direct. I think maybe for someone who has even more difficulty articulating their feelings or difficulty speaking, then I would be focusing on trying to observe how they're interacting or what things they're doing, and keeping in mind what their level of ability and function is, because that would also play an important role in what they're capable of doing.
Okay, there was another question that came in. Are loneliness and depression factored in as comorbidities?
So I guess I would need maybe a little bit more clarification of comorbidities in which section of what I presented.
Yeah.
In terms of, I guess, some of the things about mental health and brain health, those results are adjusted for other things that could contribute to poorer brain health or poorer mental health. So all of the studies that I showed on the brain health slide adjust for things like depression, but also for physical activity and general physical health, and also age and sex. So those findings are quite robust. And usually I would see in most studies that if you're trying to look at loneliness, people would take into account whether people are also experiencing depression or anxiety, because they are so interrelated.
Yeah, there was a question recently, Kelly, too, that kind of talked about the role of antidepressants in this. And I think, speaking from my experience interacting with clinicians, when you look at the whole being of someone, we're looking at their dementia, heart conditions, lung conditions, et cetera, then you start to look at medications as a whole, too. So depression, isolation, I think certainly should be factored into that, and the whole treatment of a person.
Okay. My father has moderate dementia and forgets everything that happens. If he feels lonely, will he forget that feeling too?
I mean, that's a really great question. And I mean, possibly he might. I wouldn't have an exact answer for what his experience necessarily is, but certainly if he you're forgetting things quite regularly, then there is the potential that he may forget that experience as well.
Yeah, I think, Karra, I think you're right. Our residents, and I'm sure a lot of people can relate to this, whether they're a resident of Arden Courts or living at home, one of the most common and frustrating questions that we get, or statements that individuals with dementia make, are, I want to go home. And I think we often struggle how to answer that question. What we find, at least in the Arden Court setting, is when people ask that, it comes from being upset and anxious and wanting to go home. When we ask that question, what is home? Where is home? Talk to me more about how you feel about that. We start to realize that home isn't necessarily always a location. It's a feeling that they want to have. But in having conversations about it, that anxiety and worry tends to go away, which in my opinion is an emotion, which I think depression and things like that, you can draw parallels. I feel lonely, I'm anxious, and if we can get them redirected from it, or to their point, from a dementia perspective, it's a memory impairment. Will they forget it? There's a possibility of that.
Yep. What role does involvement in faith, religion play in reducing one's risk for mental health disorders?
So I think I could maybe speak to that in terms of loneliness, at least, and I wouldn't necessarily comment more broadly on other mental health conditions, but at least specifically in terms of loneliness, it seems like being involved in a religious community is somewhat protective against loneliness or social isolation, at least from the perspective of you have more social connections, and being a part of that community group and that involvement can certainly be very beneficial for someone.
This message or question is for Brandon. How is loneliness dealt with at Arden Course during a pandemic, since they can't have visitors?
Yeah, so it's funny because Karra and I were talking about this before we started the Zoom, and it's hard. And I think I learned a little bit too from Karra's presentation today about, you know, what really is loneliness, because you can still feel lonely when you're surrounded by other individuals. And I think we kind of have to ask ourselves, you know, is it our concern that our loved one is lonely, or are they actually lonely? You know, is it our concern and our worry, or are they? And, you know, I think while families can't visit right now, as unfortunate as that is, there are still socially engaging, stimulating events, programs, activities that are going on inside of our communities. You know, we don't look to replace family in any regard, yet we have heard from family members that they consider us to be family. And I think a lot of our caregivers feel that way, that our residents are their family, and we do our best to engage with them and make them feel comforted and loved. So I'm not sure, you know, I kind of question that based on Karra's information. You could be surrounded by people but still feel lonely, but I think we've done a great job over the past 11 months trying to keep our residents feeling that they are that they are a part of a community and that they have a purpose within it.
Okay, this message is for Karra, or the question's for Karra. Can someone be inherently lonely most of their lives and it just compounds as they age?
I think that we all have different needs in terms of what we need socially, in terms of the quality and the number of interactions that we have. And so certainly there seems to be some research about that people may have naturally a higher or a lower level of loneliness that persists over time. I don't know that anyone has necessarily looked at in the research so far whether that gets worse as someone ages. It seems that aging in and of itself doesn't increase loneliness, but there are certain things that happen as we grow older that are related to loneliness. So things like loss and bereavement, where we're more likely to experience those later in life, can increase our vulnerability to loneliness. So perhaps if someone had a higher level of loneliness throughout life and then had more of those experiences later in life, there is the potential that it could increase, but I don't know that we have good scientific evidence to necessarily show that at the moment.
Okay, I think this is going to be a question for both of you. In memory care, it's hard to make friends at the same time of social capability among residents. Do you have suggestions that will increase the feeling of being connected in this type of environment, other than becoming friendly with the staff?
Well, yeah, speaking from an Arden Courts perspective, and it's one of the, you know, trying to meet the needs of all of our residents who are at different stages of their dementia journey is always a struggle, but I think it's something that we really try to work hard on. We have everything from dual programming, where we'll have the same event for two separate groups, one that has a different capability and socialization than the other. We also have something we call engagement therapy treatment, which is very specific programming for individuals maybe that like art. We'll pull them together and we'll discuss an artist and different paintings and have them draw art or participate in that. So we try to get specific and try to pair residents up into their social engagement. I can appreciate the question and the comment, though, when you're in a residential care community and you have residents of varying stages of the dementia, to try to put them all together and try to, it's almost square peg round hole, you know. if not everybody likes bingo, then we're not going to say everybody's going to play bingo. So that's where we get to know the residents on an individual level and then try to pair them up as best we can with others that have similar interests. I don't know if Karra, if you have anything to add.
I think I would agree with that, Brennan. I think it's really about thinking about who each person is as much as you can when you're caring for a number of people in the same setting, but trying to meet each person with where they're at and their needs. And I think some of the difficulty of this is reflected in that number that I showed of 61% of people in care settings are reporting that they feel lonely. There is this extra challenge of the other people that I'm here with maybe aren't interested in the same things as me or don't have the same capabilities as me. So trying to form those connections can be challenging. But I think the approach that Arden Courts is taking of trying to provide different opportunities that can meet different people's needs is probably a helpful approach to that.
And I think to your point too, different stages, different, I always try to explain this to some of the family members when they ask questions or have concerns. We all have good days and we all have bad days. And I think asking some of the questions that Karra proposed, asking it on one day and taking that to be law might not be the best, and you're going to know when your loved one is having a good day and a bad day, and maybe asking that question on each of those days and trying to find somewhere in the middle is going to be your best assessment as to how they're feeling.
Mm-hmm.
Okay, this is probably going to be a question probably for Brandon, and then Karra can probably dovetail on it. I find that I'm much more concerned about my husband's isolation than he is. He does. He has Alzheimer's and Lewy body dementia. I mean, I get that just because of the disease.
Yeah. I mean, it's not surprising. Too often when families walk through our doors and say that they're looking for their loved one, my immediate concern is for the caregiver and not for the individual with dementia. I have complete confidence that we're able to meet the needs of individuals with dementia inside our communities, but it's the caregivers sometimes that are struggling the most. It's the caregivers sometimes that, in my opinion, are dealing more with isolation and loneliness. You're living with your spouse, but your spouse is no longer your spouse. So you feel alone, even though you're living with someone. Whereas the individual with dementia is, for lack of a better term, kind of numb to the notion of why would I feel isolated or lonely? And they also have some other memory impairments. So I appreciate your concern and your care and for the well-being of your loved one, but too often caregivers are so focused on what they can do for their loved one with dementia that they lose sight of their own health and well-being.
Mm-hmm. Yeah, I would agree with that. I think it's really hard to tell from the outside, so you may be able to see that he is more isolated or more withdrawn, but it's really hard necessarily to know what his experience of that is like and how he necessarily is feeling about that. And I would also agree with Brandon about it's really important for the caregivers to also be getting support and taking care of their own social needs and watching out for their own loneliness, because that can really creep up when you're so focused on your loved one and caring for them, which of course you are, and rightly so, but also for you to be able to continue caring for them and for doing that role, you also need to take care of yourself. And so that's part of the caregiving, is caregiving for yourself so that you can be there for your loved one too.
Yeah, and I don't mean to say that everybody needs to move their loved one to Arden Courts. Clearly, that is what we are here to do, to take care of those individuals. But I think there is a time when some of the caregivers have to say, it's actually best for me, for my loved one to move into Arden Courts. I have such compassion and empathy, sympathy for all of the caregivers out there, because it is such a Herculean task to care for someone with dementia. But in doing so, we don't get to see friends. We don't get to socialize. We don't see family, either because we're embarrassed or because it's not possible. There are so many factors, but that's where you start to get concerned about the caregiver themselves. So even if you're not going to choose to move your loved one to Arden Courts, you still need to seek help for yourself.
So I guess this is a good time for this question, which also appeared in the chat room. How do you start the conversation about nudging someone towards assisted living?
So, well, there's two questions. There's that, that's kind of, so assisted living or memory care. Assisted living, I think it's important to just have an open conversation. My parents are at a stage in their life where we're starting to have more frequent conversations about power of attorneys and living wills and desires towards end of life. They're not ready for assisted living yet, but we're having those conversations. And I think that's important as early on in anyone's life to just say, if this, then what? What are your wishes? What do you want to do? When it comes to memory care, unfortunately, I think, we're starting to run, while I can appreciate someone wanting to get their loved one's acceptance and buy-in and involvement, this individual also has a brain impairment, and you're asking them to make a judgment decision. And I sometimes I think that can be unfair. It's very dependent on where they are in the disease process, but as the caregiver, and 99 times out of 100, as the designated power of attorney, they have already chosen you as the one to make decisions on their behalf. And sometimes we have to do that.
Okay. Any suggestions about how to support a loved one who tells me he's doing just fine and isn't lonely, but whose memory is definitely slipping, likely because, at least partly, his social isolation? He's resistant to learning about and using technology, so online activities aren't an option.
Yeah, that's a good question. I would try maybe to think about, for this person, what are the things that they're interested in, or what are the things that they have done previously in their life, and trying to match that with where they're at or what their capabilities are now. So they might not be able to do woodworking anymore if that's what they enjoyed, but maybe there are some other ways of having conversations about that, or watching videos about that, and trying to engage them in things that are meaningful and interesting to them, and creating some opportunities for connection. I think what we see in the literature is, especially for older men, they don't tell you that they're lonely. It's very much more about going about things in a more indirect way to try and get a sense of how they're feeling about things. So some of those other questions sometimes are more helpful in trying to get a sense of where our older men are at, because if you ask them, do you feel lonely? They're not going to say yes most of the time.
Okay, this is a very important question. How do you feel about support groups for family caregivers?
I mean, I guess from my perspective, and maybe I don't work in this space as much as what Brandon does, so Brandon, please feel free to add anything. I think support groups are helpful in giving people another community or other opportunities to connect with people who have a similar experience to them. So I think depending on the support group, it could certainly be helpful, but I think it also matters about the individual caregiver and whether that's something that they're wanting to seek out and find helpful for themselves as well. Because I don't think it's a one size fits all solution.
Yeah, I think, I think certainly a support group, a group of people, a community can help with loneliness and isolation. One of the previous webinars we had a couple of months back now really talked about the benefit of support groups. And I believe it was Gary Kelly that kind of said, you're not alone. It's not your fault. You didn't do this. And sometimes you need to have other people tell you that. Sometimes you need to just say that to the right group of people. But I think with this disease, dementia, I continue to be amazed by the spouses and caregivers that do it by themselves for as long as they can. And I just always say Superman couldn't care for himself and another human being. It's just not possible. Everyone has a limit, and knowing when that is, talking to others, finding out what theirs are, what resources they've utilized is always helpful.
Right. And a number of our Arden Courts communities are holding virtual support groups to help keep you safe. So they're at various times, various days. So if you're interested in any one of those, you can contact the Arden Courts community nearest you, and they'll give you information. It's all free. Please join. So that's my little tidbit. I had to have something in there. Brandon and Karra, when do you think there'll be more access to residences, to families, and to service people? I think in light of the pandemic is what they're referring to.
Say that one more time, Kel.
When do you think there'll be more when do you think there'll be more access to residences for families and for service people in light of the pandemic?
Yeah, I don't know if Karra has any thought on this. I mean, everything that I'm hearing from our clinical experts inside of our organization, we've got to get closer to that kind of herd immunity, and whether that's through increased vaccinations, unfortunately through more individuals that have had the virus. But the closer that we get to that, the more apt we're going to be to open up the residences to families and friends. I can assure you that our organization on an almost daily basis is having conversations about how we can find ways to safely allow families and friends to visit again. We can't understand, and in some cases can understand, how difficult it is for you. We want to be able to open the doors back up, but it's just, we're very thankful. Positivity rates are declining in many areas of the country right now, but just not to a level where clinical guidance feels that it's safe to open up to visitation, especially with vulnerable populations. Again, the more vaccinations, especially in our residents and our employees, then we're starting to get closer to, an immunity perspective, at least inside of our buildings.
Let's hope we continue on this. Yeah. Well, I want to thank you, Dr. Harrington and Brandon, for joining us today. I really appreciate all the information you gave to us. It was eye-opening, and I really appreciate, and I think we helped a lot of people today. So thank you, guys.
Thanks so much, Kelly. Thanks, Brandon. Thanks for everyone for listening.
Yes, thank you, everybody out there. Until next time, keep safe, and we'll see you soon. Take care.
Stay warm.
Stay warm.
Take care.